Okay. All right. Good morning, everybody. It's great to be here on a beautiful New York morning. I just got back from Las Vegas, not to gamble, but to be at Harry Reid's funeral. But it's great to be back in our city. I want to thank our great mayor. He is off to an amazing and wonderful start. And our great new member of Congress, Richie Torres, who's here with us. And we have a few other folks from Bellevue who do a great job. So thank you for your service, everybody. Appreciate everyone being here. And why are we here? We're here today outside of Bellevue. This is one of the greatest hospitals in our city and in our country. And not only one of the greatest public hospitals, which it is, but one of the greatest hospitals, period. And we're here to say we've just delivered a home run. We've given $1 billion. We've gotten the federal government, FEMA, to give $1 billion, $1.19 billion to our H+H, our Health and Hospitals Corporation, for all the work they did fighting COVID. Our hospitals corporation went to bat when COVID occurred. You all read about what happened at Elmhurst and what happened at Lincoln and so many of the other public hospitals in a particular a poor area that was afflicted by COVID, and they went all out. But FEMA was very slow in reimbursing them. FEMA came up with some crazy rules that said, well, if you built a new building, we'll reimburse you, but if you used your existing building, we weren't going to reimburse you. So Congressman Torres and I led the charge. We called FEMA, we shook them up, and we heard just this past 2 days ago that they're going to send New York City the full $1.1 billion. Mayor Adams had already talked to me about that and lobbied about it. So we are glad that's going to be there. We need it, and it's going to pay for a lot of COVID expenses. We all know our hospitals are under duress right now because of Omicron, and this money will help FEMA, obviously, and derivatively help the city with its budget, because the city would have to lay this out if FEMA wouldn't have come in to do it. Okay? They had filed for the reimbursement in 2020, but they didn't get it till the beginning of 2022. And they had, as I said, a crazy idea of how to limit their funding. We leaned on them, and the money's here. But that's not all. We now have Omicron. There are new expenses that the hospitals have. They're doing a good job because we know more about Omicron and it's less deadly than the first wave. As the mayor will tell you, as our hospital officials will tell you, they're handling it, but it's costing a whole lot more money. And today I am saying to FEMA, we are saying to FEMA, no more delays. When the city applies for relief money from Omicron, we can't wait another 2 years. We need the money now. These people, these nurses, these doctors, these clerical workers. My mother-in-law was a clerical worker at Coney Island Hospital, so I know a public hospital down in the southern end of Brooklyn. She was an active member of 1108. I don't know if anyone's here from 1108. She used to bust Arthur Cheliottis' stops regularly. But in any case, we need the money now. So we have already told FEMA, get the new money out immediately so our hospitals can do the job that they are meant to do. It's very, very important. And so here's what we say. I'm always provided with visual aids, Mayor. We need to get ready. FEMA, get ready. New York's going to be asking you for more money. We need it. And remember, this is FEMA because it's a public hospital. FEMA does public. But we also have our private hospitals. Our nonprofit hospitals need money as well. Northwell laid out, for instance, on Long Island, close to $1 billion because of COVID. They're laying out more money now. So are our other private hospitals. And we are asking FEMA, not FEMA, but HHS to reimburse them quickly as well. The delays we had were unacceptable, both on the public side and the private side, and we're not going to tolerate that again. Let me see if I've left anything out. Okay. Angelo?
You left out the cost of the current Omicron surge.
Yeah, where's that? Oh, yes. So far, Omicron has cost New York City, just H+H, $111 million. It's going to go up. We need that money now. We don't need the mayor having to tell other departments, we can't give you money because the hospitals have an emergency. We have an emergency. We need it for everybody. So that's what we're fighting to do. With that, let me call on our great mayor, who, as I said, is off to a great start and is a Brooklynite to boot. And then we will have a voice from the Bronx, Congressman Torres. Mayor.
Thank you, Senator. Really thank you, Senator, as well as the amazing Congressman, a good friend, Congressman Richie Torres. And I remember having the conversations, when prior to election,
Right.
and telling the senator how important this is for the hospital system, and it just really shows that Senator Schumer is a GSD senator, gets stuff done. That's the energy and spirit that we have. And to this, my amazing team, my GSD team, getting stuff done. Deputy Mayor Williams Isom, who's here, Dr. Chakshi, who's here, Dr. Katz, a longtime friend, thought about just being preventive in medicine, Bill Hicks, and Dr. Fasan as well. This is an important moment for us because my healthcare system and the city's healthcare system, we were concerned. We were concerned that with FEMA played a bureaucratic game of after we provide the services and do the right thing on the ground, that we were going to have to wait to be really shallow in bureaucracy to move forward. These hospitals were on the front line. They responded to the call, especially our public hospitals, and what we were able to accomplish. H&A spent over $2.5 billion to fight COVID during the first surge. And, you shouldn't have to worry about how you're going to be paid. They did their job, done it. The federal government needed to do its job, and Senator Schumer heard that. And much of this money was spent during the month of March, April, and May of 2020. The pandemic was at its worst. It was at the peak. We saw what happened, the morgues and trucks of bodies outside our hospitals. But we had to act fast, increasing staffing and more hospital beds, purchasing PPEs and ventilators, and retrofitting facilities to handle the COVID surge, and that is exactly what was done. And we saw the hospitals move without hesitating. So why the heck did FEMA hesitate? That is irresponsible and unacceptable, and that's what the senator and the congressperson made clear. The lag time that we experienced had financial consequences, and it was real. H&H submitted bills in October 22, and FEMA only now started the reimbursement process after the congressman and the senator put heat on them to get it done. We need to move faster and get things done now. The $1.1 billion that this dynamic duo pushed and fought for our city and state is going to do so much to help take the anxiety over will the bills be paid. Today, we're saying yes, those bills will be paid. That is making sure that our city, our hospitals get the resources they need, especially during the midst of this new surge. And so we are really pleased on what you have done, but we still have a bill out there. $111 million. This FEMA reimbursement is critical so this team can do the job that they need to do. And so while we're in the midst of this new surge, we want to know that we're in the midst of the great hope and prosperity that this city is going to have because we have a team in Washington that's fighting on our behalf. And let me conclude with this. My briefing this morning from my healthcare professionals are telling me that our children are more likely, 4 times more likely to be hospitalized if they don't receive the vaccine to fight against COVID. Parents, I am a parent, and I'm going to do everything for my son for now and in the future. We need you to vaccinate your children. We need our children to be vaccinated. This is an opportunity to do so, and we need you to lead by example for you to get vaccinated and the booster shot. Hospital rates go up and deaths go up if you're not vaccinated. So we're doing our part. As parents, we need for you to do your part. so we can get through COVID together, open our city, and save the lives of our families. Senator, thank you so much for what you have done and continue to do. And thank you, Congressman.
Thank you. And just to underscore, the bottom line is very simple. COVID's a bodily disease, but it also bleeds our hospital system.
You could say it with your mask off.
Thank you, Angelo. I always listen to my staff. One of my best former staffers, who had the same job Angelo now has, is now working for the mayor, the great Max Young, who's getting married soon. What do you think of that?
Thank you, John.
Can I invite everyone to the wedding? If COVID's over, you're all invited. Okay. But the bottom line is, yes, we need the help. And I had a great partner in this. I'm always fighting for money for New York. And there are certain people in Washington who have been just exemplary in that fight on this issue, on public housing, on so many different issues. And we have a real rising star in our New York congressional delegation, the great Congress member from the South Bronx, Richie Torres, whose name Richie I always repeat because I asked him if he was named after Lionel Richie. No. He was named after the great singer Richie Valens. How many of you have heard of Richie Valens? Raise your hands. He's the one who died in the airplane crash with the Big Bopper. That's right, La Bamba was one of his great songs. Anyway, here not to sing La Bamba, but to sing Dollars for New York is Richie Torres.
Well, it's an honor to be here from the Bronx to Bellevue, and a $1.1 billion reimbursement is a powerful example of what can happen when there's a strong partnership between the mayor and the New York City congressional delegation. And the leaders of that partnership is Mayor Eric Adams and Majority Leader Chuck Schumer, who are the dream team, the team that we need to effectuate the swift and strong recovery of New York City. You know, we all know that the impact of COVID-19 was not evenly distributed. New York was the hardest hit city in the country during the peak of the pandemic, and Health and Hospitals was the hardest hit healthcare provider within the city. It not only had the most cases, but it had the most severe cases. And so back in July, the Majority Leader and I, as well as the rest of the congressional delegation, called upon FEMA to fully reimburse Health and Hospitals. But before our intervention, FEMA had been resistant, claiming that it would only reimburse Health and Hospitals for COVID rather than non-COVID facilities during the peak of the pandemic. But we New Yorkers knew that in the early weeks and months of the pandemic, there was no distinction between COVID and non-COVID. The healthcare system was nothing but COVID.
Had to use every bed.
Every bed. Like, Health and Hospitals was so overwhelmed with COVID hospitalizations that it had to expand the ICU bed capacity by 360%. And since there was virtually no testing and no vaccines, every patient entering the system either had COVID or was presumed to have COVID. And so the bureaucratic reasoning of FEMA was out of touch with the reality that we as New Yorkers were experiencing on the ground. We all remember the images of overflowing emergency room and those refrigerated trucks full of dead bodies. You know, the healthcare heroes of Health and Hospitals, led by the great Mitchell Katz, represents public service at its finest. And those healthcare heroes deserve more than our praise. They deserve a mayor and a congressional delegation who can deliver. And delivered we have $1.1 billion. $1.9 billion. And I couldn't be prouder because there's no set of public servants who are more deserving than our healthcare heroes. Thank you.
Thank you, Richie. Okay, we're going to take questions on this subject, three of us.
Majority Leader Schumer.
This subject.
Yes, sir.
Mr. Reindeer.
So,
Are you Donna, Blana, Dancer, Blixen? Go ahead.
I couldn't find another one. Majority Leader Schumer, when you're standing next to the mayor with this funding for Health and Hospitals from FEMA, what does it mean to have that city and government partnership? And also, President Biden, did he have any influence on this as well? And what will his role be going forward? And Mayor, how do you feel with this government response? What do you think is the broader picture? Should we expect more cooperation between both
Well, one of my jobs is to deliver money for New York, and we have delivered in the four crises $250 billion to New York State, over $100 billion to New York City, not just to the city government, but to our hospitals and to so many different areas, our small businesses, our arts venues. That's our job, and I work relentlessly at that. And it's great to have a mayor who gets it, who understands it, who makes any call you ask him to do. As Richie Torres said, it's a great, great partnership that we have with the mayor. I did not have to go to President Biden on this as majority leader. I have a little bit of clout. All these heads of agencies call me up for this, that, and the other thing. And I don't make it a quid pro quo. I want to help them, but I say now I need help too. And we need help too. And that's how it worked. It took a while because the bureaucracies have the dumbest rules. So one of the rules was if you used a bed inside the hospital that was a regular bed for COVID, they wouldn't reimburse you. But if you built a new unit, which would have been wasteful, we didn't need it, they would reimburse you. It made no sense. So we had to dispel them of these dumb notions and get the dollars. We'll keep doing it. There's a lot more help that we need in a variety of different ways. Mayor, did you want to answer?
No, you answered
Okay.
well.
Well, he asked you.
For the mayor and Dr. Katz, has anything changed since then on how you categorize expenses so to avoid this situation in the future?
Sure.
Just say who you are.
Hi, Dr.
With your
Mitch
little
Katz.
hat, we didn't
You see my immunization pro, as the mayor said. So first, welcome to Bellevue. Is the longest-running public hospital anywhere in the U.S., created before the signing of the Declaration of Independence, and has played a huge role here in taking patients who are particularly sick from the other hospitals. Omicron has posed problems that are different from the other waves, primarily that we have lost so many staff to Omicron, have about a quarter of our staff are out sick. That's needed, therefore, for us to focus on bringing in outside staff. And so the $111 million that the mayor has graciously provided us with is being used right now to supplement staffing so that we can continue to run and make our mission happen. And we're so grateful to the senator and congressman for bringing that $1.19 billion to us. Thank you.
About how you categorize expenses so FEMA doesn't have to go.
No, we've made FEMA change.
Yes,
Okay.
yes. FEMA now, I think, better understands how the expenses are related to the actual care. We're here to take care of people. We're not here focused on, this nickel, that nickel. We want to make people well. Thank you.
Any other questions on this subject? Okay, we're just doing this subject.
With COVID, we've had contractors coming on direct, and they are not asking residents if they are COVID tested or protected. What are you going to do about the corruption?
That's not-
NYCHA and HUD, which I am
Ma'am.
suing them for, and nobody is
Ma'am,
telling us
excuse me,
what the
ma'am.
need masks and home test kits.
Ma'am, I'm gonna give you both. Okay? I'm gonna give you both. Here's my staff right here, and I'm gonna talk to you as soon as I finish, and I'm gonna give you both. Okay? Ma'am, I said I'm gonna give you both.
Thank you,
I'm gonna
ma'am.
give you both.
Thank
Okay?
you.
Speak to my staff right here, and I'm gonna speak to you as soon as this press conference is over. Okay? Because we are a get stuff done, and I'm gonna get that done for you. I'm gonna give you masks, and I'm gonna give you.
fighting for money
Okay? We're gonna get it done.
Total
And when you right over here?
Yeah.
Okay, I'm gonna walk with you over there as soon as I finish this. I'm gonna walk with you over there, okay?
Okay.
All right.
Other questions? This subject. Yes. Yes, that is for past reimbursement. The 111, and there'll be more than that, is for future, and we don't want to wait another 2 years. So there are 2 points here. We got the 1-1. That's going to be of huge help to the city. It goes into their coffers. They've already laid out the money so they can use it for lots of other things, even though it's reimbursement for the past. And second, we need the new money quickly. We can't wait that long. Okay? Thank you, everybody.
Can I just ask about the 95 disaster in D.C.? Any movement from Pete Buttigieg on that? Drivers were stranded on the
I'll have to get back to you on that.
Thank you.
Okay.
I'm gonna stay for some off topic questions as soon as.
Yeah, just let me ask you one thing.
Tell everybody else they can move.
Yeah. He's gonna come back and look at it.
Thank you, clean the bin. Yep. How you, man? As well. Thank you. Hold on, one moment. Let them get clear. Yeah.
Yes, they're out. 19-year-old was shot and killed, as you know, this morning in East Harlem. Do you have any comment on that, especially in light of the public discord between the DA and the police commissioner regarding being told on crime?
I'm going up to Harlem today to speak with some of the clergy leaders around the shooting response. And, just think about it. A 19-year-old girl was shot while in a fast food location doing her job. And, every time I hear people just don't understand how these guns are destroying lives, and I'm really troubled about it. And I'm going to continue to staff up with the right team to deal with the gun violence in our city. And this is not only professional, it's personal. That family is traumatized, and I'm going to reach out and give them the support that's needed. And the police commissioner and I have said over and over again, that's the prerequisite of our prosperity, public safety, and justice. And I stand with my police commissioner. I have a great relationship with the DA. Any concerns I have, we're going to speak about that privately. I'm not going to let it play out in the media, and we're going to come to a solution to keep our city safe.
Mayor, what qualifications does your brother have to serve as your security detail? Do you understand why some people are concerned about the appearance of nepotism?
No, I'm not. I don't understand that. Protection is personal. We have an increase in anarchists in this city, country. We have a serious problem with white supremacy. And when you talk about this type of security that I want is extremely unique. I don't want to be away from my public. Many people saw me take the subway. That is how I'm going to move out the city. My brother knows me. My brother, I trust him. He's a 20-year veteran. He was an extremely successful community affairs police officer as I bridged the gap. And not only he's going to look over the security of Eric Adams, but also of the other lawmakers who are entitled to security. I trust my brother. My brother understands me. And if I have to put my life in someone's hand, I want to put it in the hands of the person that I trust deeply, because that is a very personal process of your security.
Do you plan to get a waiver from the conflict of interest court on this?
That process is underway. Wait. Come on, guys. Y'all know how I flow. We're not going to yell out. I'm not going to be chaotic.
Yep, you got it. Liz, going to next.
I'm going to pick the best people to do the job to keep my city safe, so we don't have 19-year-old children shot while they are working. Phil is the best person for this job. When Phil was chief of department, he brought down crime, and he did something else. He reined in the abuse of stop, question, and frisk. That's the moment we are in. Phil is going to prove to New Yorkers he's the best person for this job. And I am excited about having him on my team. He's the best person to assist me in ensuring all of my law enforcement agencies are coordinated, and this is a safe city. And I'm not going to move away from that.
Yeah.
Do you think it is the case that in this city of 9 million people, there are not at least a dozen others who are as qualified or even more qualified than your brother, but don't create the appearance of nepotism?
No, I do not. Personal security, my life I want in the hands of my brother with his 20-year law enforcement experience. He has the police experience, but he also has the personal experience. He knows his brother, and he's going to keep his brother safe during a time of increased anarchists, increased white supremacy, increased violence and targets. My life is going to be safe in the hands of my brother, and he's qualified to do the job.
Right here. Mayor, why do you support the documented voters?
I always believed when I stood with Adonis Rodriguez to talk about the legislation. I believe that people who are here during COVID, our legal residents, they did not flee the city. They stayed here. They provided a service. My concerns around the 30-day, I sat down with my colleagues. We came to a good understanding, and I think it's more important to see the bill move forward and allow it to happen. And I'm proud of this moment for our city, who is a city of diversity.
Right here. Thank you, Mayor. Hate crimes in New York City. What is your plan to do about that? What is going to be your effort more broadly to combat hate crimes?
It's a combination. You know, I use the term all the time, intervention and prevention. Let's look at prevention. We are a divided city. Why aren't we teaching our children better in schools with lesson plans? We were on Staten Island a few days ago, and the teacher had an amazing program where she teaches the children the beauty of living in a diverse city. That needs to be part of our school curriculum so we can start raising children that won't involve themselves in hate crime. That is prevention. Intervention right now. We're going to beef up our task force around hate crime and our police units. We're going to partner with the district attorneys to make sure we properly investigate these cases. And we're going to use technology, video surveillance. We're going to use undercover officers to go into the communities that are experiencing this, particularly our Chinese and East Asian communities. We're going to be very clear that we're not going to have a community where people are attacked based on their ethnicity, based on their cultures.
And a follow-up
Two more questions, Stephen. And then you. To some extent, it seems like things are unraveling in schools. We have reports of schools that have run out of tests. We have 6, 7, 8 classes at once in auditoriums. Very little learning actually going on. I know we want to keep schools open, but how do we distinguish between schools open and actual learning happening? How's the approach changing?
That's a good question, and I really need for people to embrace this concept. The importance of keeping schools open, is a holistic approach. Academic is a crucial part of it, but it's also a safe space for our children. You know, there are many parents, if we disrupt their ability to have their children in schools, we're disrupting their ability to go to work. That's a financial crisis. Many of these children don't have meals at home. Those 2 meals they receive, breakfast and lunch, are crucial. And the teachers pivoting, because COVID is changing, and creating an environment of having classes in the auditorium, of reading, being creative. I have to take my hats off to the teachers and educators. And I really want to commend Michael Mulgrew. We sat down and we put together a plan, and it's not unraveling. People wanted us to close schools on the snow day. We were steadfast and said we can get through this. Department of Sanitation. So I think that we're looking at this from a negative instead of a positive. We are doing a great job. 65% of the children were in school pre the holiday break. We went up to 70-something%. We are doing an amazing job, and we need to really commend ourselves that we're not allowing COVID to make us live in this fear. We have to push through this. COVID is here. A new variant may come. We can't continue to have children out of school. I'm not going to allow that to happen.
Are you saying it's okay, it's good enough for teachers to basically become glorified babysitters rather than actually teaching classes? That's a good enough baseline.
No, that's not what I'm saying, and that's not acceptable for us to do that. But what is acceptable is to utilize the tools we have in front of us to get through COVID without harming our education in the long run. Our children miss too many days in school. And if they're in school in a caring, safe environment, receiving instructions like they are, because I was on Staten Island and instructions were taking place. We're still having instructions in our school, and I support that.
All right, last question, just
How are you?
If you could respond to a publication in the New York Post today, the summary, Sergeant Schumer says that an ADA working on development drag whitewashed a police report regarding a robbery last week in Chelsea. They took out the details about the scissors involved in the robbery, about the words that were and so the idea is that this lowered the charges to basic shoplifting and a perpetrator who should have gotten higher charges, got lower charges. The broader picture being, DA Bragg taking a softer approach to crime in response to.
Yeah, I'm not familiar with that case, and I'm sure the police commissioner will look at that case. I'm not too familiar with it. I believe that DA Bragg is going to be a partner to keep our city safe. We're going to go through any disagreement or lack of understanding of any policy in that office to come to a solution together. And I don't want it to play out in the media. It must play out when we all sit down together and make this a safe city. I ran on that. I believe it. And I'm not going to compromise the safety of the people of this city.
Thank you, everybody.
Somebody up here.
Howie, nice to see you. You're one of